Hello, everyone. Welcome. I'm Rachel Newman Green. I'd like to invite you to welcome you to join the Rhode Island Hunger and Elimination Task Force Quarter 4 meeting for 2023. I think the first question I want to ask is that some of the folks who are speaking today and other folks indicated a little bit of a challenge with getting through the registration process, getting in. And I guess we have a little bit of a thinner crowd than usual. So those of you who did get in, could you give me a sense, did you have any challenges getting in that maybe we should give people a couple more minutes to make sure we have everyone who's trying to join?
I thought it was easy.
All right, good. That's great. Thank you. All right, so maybe that is not the issue. All right, thanks very much. I'm going to go ahead and share my screen. And we'll get going. There we go. You all see that okay? Oh, you know what? All right. I am glad to be here with you all today. We are encountering a little bit of technical challenges because we usually have more hands on deck for the technical aspects of this meeting. I'm working on both moderating the meeting today and monitoring the technical aspects of it. So I really appreciate any patience that you all are able to have with me. It's definitely a little bit of a challenge, but I'm sure you all are familiar with the technical challenges that come along with operating in a Zoom world nowadays. So thank you for your patience and any hiccups along the way. I've hit the record button, so this meeting will be recorded, and that recording will be available after the fact if anybody's interested in it. Again, my name is Rachel Newman Green. I am the Program Director for Food Access and Nutrition Security with the Rhode Island Food Policy Council. I am joined by Randy Bellhumer with the Department of Health and Alice Macbeth with the Department of Commerce, as well as my colleague Nessa Richmond from the Rhode Island Food Policy Council as well. Let's see. If you wouldn't mind, as we move forward, it's going to be difficult for me to monitor the chat, but please put into the chat your name, your affiliation, and so we all get to know each other a little bit better and celebrate the season. If you have a favorite Thanksgiving side dish that you make in your family or your tradition, that would be great to know. So, as a reminder, for those of you who may not have joined us before, who have been here before and a refresher is helpful, the goal of the Hunger Elimination Task Force is to reduce hunger and increase access to healthy, culturally appropriate food for all Rhode Island residents. The agenda for today's meeting, I'm going to put in the chat.
Done. It's already in the chat.
I appreciate that, Randy. Thank you.
You're welcome.
So the goals for today are to, first off, Nessa is going to give us a report on New England feeding New England and Rhode Island's role in that regional process. We are going to learn about how the state of food security in Rhode Island has changed over 2023 from some great panelists who will be with us today. And we're going to talk about goals and strategies for this group moving into 2024. Randy is also going to give us a rundown of what this group accomplished in 2023, which I think will be really helpful. Nessa, I'm going to turn it over to you to take it away. We are on slide 1. For the beginning of the regional approach to food system resilience, and please let me know when you'd like me to click through the slides.
Sure. Can you hear me okay, Rachel?
We hear you, Nessa. Oops.
Okay, great. Thank you so much. Yes, so I'm glad to have the opportunity to share information today about the New England Feeding New England project, which is a regional approach to food system resilience. And Rachel, if you can advance to the next slide, what I want to do first is just show you the series of 7 reports that are available now as a result of phase 1, the research and planning phase of this project. They're all downloadable on the website nefoodSystemPlanners.org, which we will get to you. And the reports were researched and written by a team of 17 individuals from institutions of higher education across the region. And they provide new information about topics such as resilient eating patterns, regional food self-reliance, the economic impact of our food system, and market channels and food expenditures, among others. So today I'm really going to be sharing a very small amount of information from these reports, and I hope that you will take a closer look on them on your own based on the work that you do. If you go to the next slide, you can see the logos of the 6 statewide food system networks that are the partners of the New England Food System Planners Partnership. So here in Rhode Island, the Rhode Island Food Policy Council is the partner. You can see the others there that are all state level. And in addition to that, the Food Solutions Network, which is regional level, New England Food Solutions. And if you go to the next slide, you can see that alongside those nonprofit network-based organizations, the partnership also includes a member of a state agency from each state. So in Rhode Island, that is our State Director of Food Strategy, Julie Stelmazik. And you can see here that most of the other states are represented by an individual in their state's Department of Agriculture. So going to the next slide, you can see that the project's goal is that by 2030, 30% of the food consumed in New England will be produced, harvested, caught within New England. So this collective effort focuses on expanding and fortifying the region's food supply and distribution systems in an equitable and inclusive way that ensures the availability of adequate, affordable, socially and culturally appropriate products under a variety of different conditions, whether those conditions are caused by our changing climate or other environmental or public health conditions. The next slide gives you a little bit of information about why this project is important. Food supply chain disruptions, again, whether they're due to climate change or public health emergencies, put us all at risk. And especially at risk are the people who already suffer from food insecurity. And we can reduce this risk posed by these disruptions by bolstering and strengthening our local food production, processing, and distribution capacity. So this partnership came together with the belief that New England has the ability to create a food system that's more reliant, and that the current system presents several barriers to doing so. So that in order to create a more self-reliant food system, we need the entities within that system to work collaboratively to identify policies and investments that support the kind of public and private supply chain businesses and infrastructure we need, so that by building this more resilient and strong regional food system, we are creating more jobs, a healthier population, and greater stability for our economy and the workforce that supports it, and our food supply chains. The next slide, briefly, as noted, shows you that we've just completed the research phase of this work, and we're now in the process of educating, convening, and coordinating outreach, and also moving forward with implementation of activities designed to help each state in the partnership do the work that it needs to do for the region to reach this goal of 30 by 30. So next slide, please. We're really asking, what is it going to take to grow, raise, produce, harvest, and catch more regional food and move it through a complex supply chain to get to our homes and the other places that we eat? What do we need to do in the near term, really, is the question, so that by 2030, we can make tangible progress toward this vision. Next slide, please. First, I just want to share what it looks like at the household level to reach this goal. Rhode Island has the 5th highest per capita food expenditure of any state in the country. It was $5,606 on average per year in the year 2020. And that's expected to grow to almost $7,000 per year by 2030, which means that the average household would need to spend a little bit over $2,000 on local food each year to reach the goal. Next slide. So what do we have to buy from our region to make up that 30%? This chart shows you the composition of our agriculture and fisheries sales. So you can see that seafood, dairy, and vegetables are all high on the list, while fruit and meat and eggs only make up a small amount of regional food sales. The next slide shows you what manufactured products we have available. So we have a good amount of bakery goods, beverages, fluid milk, and seafood, some produce and meat as well. But when you put that all together on the next slide, you can see that all in all, our region produces less than 2% of the grains that we need, less than a third of the vegetables, less than 10% of all fruits, about half of the dairy, and barely over 3% of the meat that the region needs. So I think what this slide really shows you is specifically when national and global supply chains break down, whether it's due to a pandemic or some other type of disaster, food security for all people is at risk. Next slide. As I noted earlier, when food supply chains break down and in other times of scarcity, people who are already at risk of food insecurity are generally affected the most. So this chart is showing you that over the past 20 years, food insecurity has ranged from about 8% up to a high of about 15.5% after the Great Recession. And then things have started ticking up again in 2022 as some of the more helpful COVID era food security programs came to an end. This is our national level data. And on the next slide, you can see that our Rhode Island Community Food Bank has estimated higher numbers. They estimated that 18.4% of Rhode Island households were food insecure in 2021. And that included over 30% of Hispanic households, over 40% of households with children. You can see on the next slide really how these inequities are not felt evenly across our population. So the areas that are highlighted in purple have higher rates of food insecurity. And you can also see the racial and ethnic disparities around food insecurity in the chart to the bottom right of this slide. So going to the next slide, I want to take a moment to step back and look at the economic impact of the state's food sector on the state. You'll see why in a moment. So this slide shows you that our state's food system employs over 66,000 people and brings in almost $12 billion in sales annually, a not insignificant part of our state's workforce and our state's economy. The next slide shows you how food system wages fit into our median hourly wages by major occupation. This is for 2022. And you can see that hourly wages in the food sector are generally low. Many of them, depicted in these two green bars toward the right-hand side of the slide, are just barely above minimum wage. The next slide shows you a closer look at just the food system occupations. And you can see here that most fall under the living wage for a family of four. That's the parallel red line there on the top. And many of them fall below the living wage for a household of just one adult. So these jobs, even at full time, often don't allow people to make ends meet, and many of them, counterintuitively, even though they work in the food sector, are food insecure themselves. Thinking back to that 30 by 30 goal and the amount we need each household to spend on local food to reach it, you'll see that the system itself has created a situation, where many of the workers within that system will not be able to be part of reaching that goal. So I think, next slide, please. You can see how that leads us into considering some of the common challenges, food system challenges in our region. Although conditions on the ground obviously vary by local contexts and cultures and ecologies, many food systems, every food system across the planet is grappling with some of the challenges that I'm about to share. So I want to just note that this list is research-based. It's not comprehensive or inclusive, but it was assembled based on 10 focus groups that were called together by the 17 researchers. And a number of them relate directly to food access and nutrition security. So on the next slide, I'm not gonna read off all of the challenges here, but I do wanna focus a little bit on the challenges that relate most to our work on the Hunger Elimination Task Force. So first of all, lack of planning for long-term food supplies. There are very few examples of long-term planning for healthy and reliable food supplies. So the New England Feeding New England project really marks one of the first regional approaches to food system planning in the country. Second, want to focus in on ongoing exploitation of food system workers. So these workers, particularly those in the retail and food service and farm workers, experience some of the lowest wages of any occupational category in New England, as well as limited benefits. Third, we have had limited progress reducing diet-related health problems. So poor nutrition, as you know, is a leading cause of death in the United States, and many nutrition-related health trends have continued to move in the wrong direction in terms of diabetes and other factors related to overweight and obesity at times. So we are now in a situation, as I'm sure many of you know, where the United States has the lowest life expectancy of any other wealthy country. The last common challenge that I want to focus on is limited progress reducing food and nutrition insecurity. Of course, with the important note that our Black and Hispanic, Indigenous, and other communities of color are disproportionately burdened with this insecurity and low food access throughout New England. So the last slide that I have for you is really just a series of questions that I want to leave you with today. Questions that I hope that the Hunger Elimination Task Force members will consider, and it will stay with you as you discuss plans for how the task force and how each of us individually can make a difference in eliminating hunger in Rhode Island over the course of 2024. How can the number of low-income and low-access census tracts be reduced in both our urban and our rural areas? What do we need to change for people to change their dietary patterns? What strategies and policies can discourage consumption of some of the types of foods, ultra-processed foods that we know are damaging to health? What additional public support is necessary to enable lower-income residents to access local and regional foods? And how can we institutionalize food as medicine strategies throughout the state and throughout the region? That's what I have. Thank you very much for your time. I'm happy to follow up with anyone on the call separately after this meeting. If you want to have a separate presentation that does a deeper dive into any of this information, please reach out to me. My email is nessa@rifoodcouncil.org, and I want to make sure that everyone feels like they have access to these 7 reports and the information in them for your own planning and your own planning needs. So thank you again, and I will hand it back over to Rachel.
Thanks very much, Nessa. That was great. And I think I was very encouraged by how so many of the questions that you asked at the end of those presentations are the very questions that we're going to be working as a group and with the Department of Health on answering in the coming year and the years ahead. So that was really, really excellent. Thank you so much. Give me 1 minute. We've had a few new people join while Nessa was presenting. I'm just going to move things around. Okay. So for our next section of the meeting today, we have a really great panel that is going to talk about the state of food security in Rhode Island today. I'm going to work on, let's see, the first person on our panel will be Andrew Schiff, who is the Chief Executive Officer of the Rhode Island Community Food Bank. Also on our panel will be Jessica Petrolia, who is the Child Nutrition Programs Coordinator with the Rhode Island Department of Education. Bethany Caputo with the Rhode Island Department of Human Services will speak about SNAP. And the last person, it will be Megan Grady, who is joining us as the Executive Director of Meals on Wheels, Rhode Island. And if you want to give me 1 second, let me see if I can get all of you up here at once. see, where did you go, Beth? There you are. There we are. Thank you. Okay, so I know you all represent very important keys in Rhode Island's food security picture today. And I know that there have been a lot of rapid changes that have happened in that picture, not just this year, but obviously in the past 3 years. So I was wondering if you could each speak just a little bit about trends or data about usage of your programs in the past year and what that has looked like since we entered the pandemic in 2020. Maybe I'll hand that over to you first, Andrew.
Sure, thank you. I'll start by just talking about the demand for food assistance in Rhode Island as one indication of food insecurity in the state. We have 143 partner organizations that we work with at the food bank all across the state. They're the folks who directly serve people in need, food pantries and meal sites. And they almost all are reporting to us that they've seen a big increase in the number of people coming for assistance this year. And in tracking it, we saw a dramatic increase in March 2023. And that's when the emergency allocation of SNAP benefits ended that had been available during the pandemic. In February 2023, across our network, we served 66,000 people. In March, it was 79,000 people. So that's a 20% increase. But when you look at what people lost, households enrolled in SNAP, and Bethany can talk more about this, lost on average $155 a month in SNAP benefits, about a third of their benefit. And overall, the state lost $13 million a month in SNAP benefits. So just that alone, you could see how that took away people's buying power in the supermarket and left people with little choice but to turn to food pantries for help.
Thank you. That is sobering. Bethany, do you want to speak to that from your perspective, please?
Sure. As Andrew said, that was a big loss to SNAP customers losing those emergency allotments every month. Right now, there are about 143,000 SNAP individuals participating in the program and 88,000 households. During the pandemic, we saw participation vary from month to month. For example, in May of 2020, participation reached a high of around 91,000 households and 151,000 participants. And then from August 2021 to May of 22, those numbers steadily decreased with some minor fluctuations from month to month. But the average during that time was around 139,000 participants and 85,000 households. I think that this fluctuation was likely due to the changing rules around unemployment insurance, the boosts, whether they were countable or not countable. For many, that increased income kicked them off of the program, unfortunately. Also may have been due to other factors like job closures, challenges with accessing the DHS offices, with staff shortages and offices being closed to the public. Right now, we're seeing our participation numbers reach pre-pandemic levels, and we expect those numbers to remain steady, but there are always factors that might influence that. like with the new ABOD rules coming into play, and certain cities and towns may become subject to the ABOD time limits, the Farm Bill being reauthorized, and what will be included in that may impact SNAP and participation numbers. But the good news is we looking at a USDA report from 2020, which is the most recent report available on participation rates. Rhode Island was second in the country with a participation rate of 100%, and that measures the percentage of eligible people who actually participate in the program. So I think that we're doing some good work reaching those people who are eligible for the benefits, and we'll continue to work on that as well as other access challenges.
Thank you so much. Megan, I know that you serve a specific population and a specific need in terms of home delivered meals. I was wondering what you've seen recently in terms of need and changes since the beginning of the pandemic.
Absolutely. Well, first, I just want to thank by recognizing and thanking my fellow panelists for their hard work. In many ways, all of our work intertwines, and so it's a real pleasure to be here with them today. We are not like a research-based organization, but what I can tell you is a little bit about our story since March of 2020. We're incredibly proud that we operated without disruption during the entire COVID-19 pandemic. And going into the pandemic, our average daily service was about 1,000 home delivered meals a day. And at the height of the public health emergency, that summer of 2020, we served to as many as 4,000 home delivered meals a day. When we flash forward in the summer of 2022, we served our 20 millionth home delivered meal. So that's 20 million home delivered meals right here in the Ocean State. And I think both of these things together contributed to the development of our 2025 strategic plan that we're currently operating under. It's called Planning for Our Next 20 Million Meals. So I think sort of in twofold, we learned a lot in our first 20 million meals. And so that informed the design of our strategic plan. But then during the public health emergency, we learned what was possible for our organization. And so that's also, a big piece of where we go from here. So yeah, our strategic plan is entitled Planning for Our Next 20 Million Meals. And that's exactly what we're doing right now.
Thank you. That sounds really exciting. We're looking forward to seeing that. And that's really exciting to hear about the growth of your organization as well. Jessica, I know that schools and summer meal programs and meals that come through RIDE have faced a particular set of challenges and particularly perhaps dynamic set of changes over the past couple of years. I was wondering if you could speak to that from your perspective.
Sure. Thanks, Rachel. So as you mentioned, at the Department of Education, we actually administer what we consider two distinct sets of programming, the school nutrition programs and then the community nutrition programs. And I'm going to speak a little bit about both sides of that today. During the pandemic, our programs were really thrust into the spotlight more than ever before, and our food service professionals in schools and in our summer program community sponsors really proudly stepped up and served their communities. And so I think it's no surprise to anyone to hear that the number of meals that we served during COVID was significantly higher than the number of meals that we're seeing now. What's really interesting and honestly frustrating a little bit about our programs is as we hear some of our counterparts speak of their challenges and the increased demand for food access and food assistance, we hope that our programs will be looked to as a means of food access and food assistance, but at the same time that the food bank is reporting record numbers of participants looking for help, we're seeing a decline in participation. And our challenges, I think, are a little bit more unique because it's not always about eligibility. And so, for example, if you look at the National School Lunch and School Breakfast programs, as compared to pre-pandemic, our participation rates are not significantly lower as a percentage of enrollment than they were prior to the pandemic. So the last school year, 22-23, compared to school year 19-20. But what we are seeing right now is actually a reduction in the number of qualifying students that are participating. So of the students that should and can access free and reduced price meals at school, we're seeing a 5% reduction in participation. So we were already only at about a 64% participation rate pre-pandemic of kids that qualify for free and reduced price meals, and now we're down to 59%. And so that's something that actually I think is, although our programs were spotlighted during the pandemic, at that time, there was a lot more equity within the programs because the meals were offered free to all. And as we saw a return to a tiered pricing system, we're seeing a stigma of these programs that prevents people from choosing to participate because they don't want to be labeled as low income. We also see things like in the school breakfast program, a reduction in participation, and that program already is significantly underutilized as compared to lunch for a whole bunch of different reasons. One thing we saw during the pandemic was schools taking more measures to make sure that kids got meals through alternative service models. And as we've returned back to this sort of normal circumstance, we're seeing a return to a traditional cafeteria service, which is definitely creating a barrier to participation. And so we're also seeing a decrease in participation, but especially as far as free and reduced students are concerned in that program. So that's kind of the school meal side. I want to speak to the community nutrition side a little bit before I wrap up, just because I think that this is a little bit less in the spotlight for people. Many have heard of the summer food service program. We do a lot of outreach around that. That program has seen significant growth leading up to the pandemic. We relied really heavily on it during the pandemic. It's a little bit harder for us to grab average daily participation numbers, but what I can say is in July 2023, as compared to July 2019, we only served 62% of the total number of lunches that we served. And so we're reaching a significantly smaller population. It's almost 60,000 meals across the entire month than we were pre-pandemic. And we're really not sure what the reasoning is for that. We know that there are staffing shortages that are contributing to community members being able to operate sites. We know that the weather adversely impacts the ability to be able to stand up these sites. There was some good news in pandemic EBT and coming up in next summer EBT that maybe is helping in the reduction of need, but since those benefits typically lag behind the actual timing of when the need is there, we're not really sure that that would have the impact. So that's one. But the really stark participation that I want to call out is under the child and adult care food program, because I think this one is not really thought of as much by many people. And this certainly could be having an impact on some of our most vulnerable people, and that would be families with children and families with young children. So in school year 18-19, we had 90 total organizations representing 424 outlets receiving meals under the CACFP. And as of last school year, we had 67 organizations, so a reduction of 23 organizations and only 331 sites, so a reduction of 93 sites. Pre-pandemic, we were serving just over 4 million meals under that program. And during the last school year, we served just under 3 million. We lost just about 1.3 million meals in CACFP. And that is just heartbreaking. It's our youngest kids that are maybe not getting meals. We're seeing childcare providers leave altogether. We're seeing them leave childcare. We're seeing them leave the program because it's onerous and administratively burdensome. We're seeing a lack of staff. And we're also seeing a little bit of a crisis on our family daycare home provider side. That's one where we've seen really significant decrease. And also we have a lack of interest in sponsoring that program. And if we lose the organization that helps those family daycare home providers access the program, we may not be able to offer it at all anymore in the state. So that one is one that I just want to point out. I don't want to leave us on a black note, but just as a challenge that we're really seeing across these programs.
Thank you. Those are significant challenges. Right. I had a few questions actually from what number of you just spoke to, and I was wondering, Megan, if you can, this is going back to what you were saying about the way that your organization has ramped up and was able to ramp up in response to COVID. What are some of the key factors that enabled your organization to grow to meet that demand more in COVID? And what do you see as the possibility of sustaining those factors so you can continue to meet increased demand?
Yeah, those are great questions. I think during the pandemic, it was really twofold, right? We had implemented our more than a meal model for 50 years at that point. So we really understood our model and how we could stretch it during a public health emergency. How we sustain that is really one of the main focuses of our 2025 strategic plan. See, this plan has 3 key themes. The first is innovation, the second is sustainability, and then the third is capacity building. So I think kind of those three topics have already been hit on in today's conversation. I think what you'll see more of from us is becoming a broader hunger-focused organization. Many people know Meals on Wheels for our home delivered meals program, and that will always be the cornerstone of how we do our work. But we're going to be taking a broader approach in the future. And so that being said, our next 20 million meals might look a little different. We are rapidly growing in the maternal health space. That's something we're very proud of, a partnership with Women and Infant Hospital, where we're serving pregnant women and their families at the household level. And also, serving individuals who have food access issues and could benefit from prepared meals. So yeah, I think sustainability and growth are kind of two things that are on our mind pretty often.
Great, thank you. To Beth, I know that there are some policy level changes that are going to be new things that people need to be aware of, and also going to be presenting some challenges to your clients. Could you speak to those a little bit?
Sure. Just recently, there was a change to the upper age limits for able-bodied adults without dependents, otherwise known as ABODs. This population has a 3-month time limit if they're not meeting the work requirements or otherwise exempt. Previously, the age range of who is considered an ABOD was 18 to 49. But as a result of the Fiscal Responsibility Act of 2023, the range was increased as of September 1st. 50-year-olds will now be considered ABODs. And as of October 1st, 51 and 52-year-olds are included. And then next October, it will include 53 and 54-year-olds. The good piece of the changes is that they also included 3 additional exemptions from the ABOD time limits, which include homelessness, being a veteran, no matter what the discharge status is, and an individual aged 18 to 24 who is in foster care on their 18th birthday. So we're trying to get the word out as much as possible about these new ABOD changes. We sent a notice out at the end of August to let folks know that the age range has changed and what they need to be aware of to maintain their SNAP benefits. Our eligibility workers have all been fully trained on the new criteria and the new exemptions to make sure we screen for those exemptions if we don't already have that information in the system. And in order to prevent people from closing due to the 3-month limit, we have what are called discretionary exemptions, which states can use at will. They get a certain amount based on their caseload. We've been collecting those for quite a while because we had a statewide waiver in place during COVID. So we're going to apply those discretionary exemptions to cases for the period of September through January. So no one will reach the 3-month time limit till probably May. And we'll reevaluate probably around that time. But that would be the biggest change, I'd say, that might have a negative impact on SNAP participants that's coming up, or has already been implemented, I should say.
Thank you. And my last question is maybe for both Andrew and Jessica. Andrew talked about the surging demand for the services of the food pantries and the food bank, where Jessica talked about the decline in utilization of the programs that she oversees. And I'm wondering if the two of you, or maybe all 4 of you, see a way to coordinate or opportunities to make sure that folks who are facing increased need are aware of and taking advantage of other opportunities such as the CACFP and summer meals and school meals that are available to them. Jessica and Andrew, do you have any comment on that?
You want me to go first, Andrew? I mean, I'll just start by saying that Rhode Island is a great state. We all know that. And we have the benefit of being small and having a tight network of providers. And so I think we already work really closely together to make sure that I know the food bank includes mailers about the summer food service program and their information packets. We include information about how to apply for SNAP and have actually tried to strengthen our ability to make SNAP referrals through the Unite Us platform over the last year. So I think there's already work in progress on that. I think systemically, it's just an issue of there are how many different agencies that offer food access benefits and how many different eligibility criterias and access points and application points. And it's confusing for families. I'm not sure it would be great if we could work together to reduce that kind of barrier to increase access for participants. But some things that we fight against, as Bethany certainly can attest to, are at the federal level, and there's only so much control we have. So I think creatively working together to try to overcome those barriers where we do have the flexibility is something that we're already pretty good at. But Andrew, I don't know what your thoughts are.
No, I think that's well said.
Thank you. I think we just have a couple more minutes for you all, and then I want to open it up to folks to ask questions about your programs. So do you want to leave us with any closing thoughts, I guess, about where you see the trend of your work, what you see the challenges and opportunities are in the coming year? I will let whichever one of you wants to jump in first.
Sure, I can go first. I'll just say that Meals on Wheels of Rhode Island is really excited about the implementation progress we've made in the first year of our strategic plan. Again, like really leaning into the themes of innovation, sustainability, and capacity building. We've added community health workers to our model. We've brought back our on-site food pantry. We've piloted, supplemental grocery delivery, and then, like, probably most importantly, expanded the population of who we serve. So we're really looking forward to this strategic journey and seeing how it gets us closer to our vision.
Thank you. Andrew, what are your thoughts on the coming year? Anything that folks need to know about your services, new things coming up, or directions that you see your work going into 2024?
Not so much our work as, one of the things that underlies the increase in need in the state is just the inflation that we've seen in the price of rent, the cost of utilities, and the cost of food. And those high prices for basic living expenses eventually, hopefully, will go down, but they won't go down quickly. And in the meantime, we really have to figure out with urgency how to make sure that people can stay in their homes, keep the heat on, and feed their families. And since Congress is not able to function in its current makeup, that puts more pressure on the state. So that's a long-winded way of saying that I think that advocacy at the state level is going to be more important than ever for us to find ways to help low-income families.
Very important. Thank you so much for that. And I'm glad that we have the Hunger Elimination Task Force and other partners working with us, because I think that advocacy in the coming year is going to be very key. And Bethany, do you have last thoughts you'd like to tell people about the direction of your program, or final information people need to know about SNAP in the year to come?
Yeah, we're excited that we're soon going to launch our Eat Well, Be Well SNAP incentives program. I know it's been a long time coming. We've experienced some delays on the retailer side, the challenges with updating the technology, but we're looking at a January implementation date. So that will help SNAP participants, spread their food dollars when inflation is so high, as Andrew mentioned, to be able to get 50% back on the purchase of fresh fruits and vegetables. So we're we requested funding through the governor's budget for summer to implement summer EBT next summer. So we're hopeful that that will roll out and we'll be able to get extra benefits to kids during the summer months. And we're always focused on improving access and improving application processing timeliness. We have the scanning centers in the field offices in the Providence and the Pawtucket, most recently the Pawtucket office. And those have seen like really good results with clients who are just there to deliver paperwork and want to make sure that it gets into their case and it's reviewed. They can just go into the scanning center and have it scanned and be in and out quickly. And that will be expanded to the new office that will be opening. Not sure exactly when, maybe January, our Holden Street Providence office, and hopefully to all of the offices at some point. And we have processing Wednesdays going on, even though it may seem counterintuitive to close the call center for one day a week. It's actually been shown to be really helpful at completing back office work, getting through the backlog of applications, and the hope is that eventually it will reduce the need for customers to call and wait on the line to talk to a DHS person because the work will be done.
Great. That'll be great improvement. Perfect. Thanks. And Jessica, do you have final thoughts and things you want to share with folks for the coming year?
Sure. So I think I painted a little bit of a dark picture in terms of participation in our programs, but I do want to at least put out there that despite the challenges we have in participation, we have made such progress in so many different areas, especially being able to access the COVID funding streams, more projects than I'll be able to really mention, but in terms of the development and growth of the Rhode Island Farm to School Network, using funds from the federal government to really bolster our purchasing in school meals from our local producers and growers. We have a project with some USDA grant funding that's related to cultural relevance in school meals. So we're really doing a lot of work to make sure not only that participants can access, but want to access our programs. And we're really excited to continue that. And as we continue to work with our partners, I will just say, to kind of echo Andrew's thoughts on this, that it's really, I think we've all come to see that we can't rely on the federal government to do the things that we know are right for our own local residents, and investment in all of our programs, not just mine, is an investment in Rhode Island's future. And if you look at the governor's Rhode Island 2030 priorities, things like supporting small businesses, investing in children and families, strengthening K-12 education, those are all things that the school meal programs, I'm sure SNAP, like these programs are proven to do just that. And so the more that we can invest them and get not just participants of those programs, but others to recognize the benefits and make it a part of their everyday life, I think the better we're all going to be for it. So I'm looking forward to continuing that work and grateful for everybody on this call in supporting that.
Thank you all so much. Okay, we have a little bit of time to open up for questions. I'm going to try to remove the spotlight from you all so I can see if folks are raising hands. And do let me know also if you, I don't think I saw any questions in the chat, but please go ahead and raise your hand either with the reaction button or give a wave in the window if you have a question for any of our panelists. Anyone? Any questions? Caitlin.
Hi, everybody. I was wondering if Megan could talk a little bit about what the community health workers have been helping with and why that's such an important role at Meals on Wheels.
Thanks, Caitlin. Yeah, so we have 2 certified community health workers currently on our team, and we have 2 community health workers who are currently in training. We were incredibly narrow in our focus at Meals on Wheels for our first 50 years. And that was, we provided home delivered meals to older adults. But what was really keeping me up at night is that we were also conducting 3 different screenings on individuals that were interested in our home delivered meal program. We were doing a nutritional risk assessment. We were screening for activities of daily living and activities for independent living. But it was almost like, regardless of their needs, we were offering a one size fits all solution, right? And so I really was thinking, there has to be like a better way to do this. And so that's where we started piloting community health work and saying, okay, well, can we do some basic navigation? When we have individuals that are opting into our medically tailored menu, can we also then offer them supports on how to manage chronic disease? And so I guess it was probably 6 months or so that we were trying to understand this work and included it in a research grant to the Administration for Community Living. And so now we're actually in a 5-year research study with the individuals from UConn serving as the primary investigators and individuals from the Brown University School of Public Health serving as supporting investigators. And what this 5-year research grant will help us understand is when we start to enhance our more than a meal model, what does it mean for participants' health outcomes? So we're very new in this journey. There's a lot going on in the community health worker space. And so we look forward to, really growing our work in the space as the sector grows here in Rhode Island.
Thank you so much, Megan. Nice to see you.
Nice to see you too.
Are there other questions for our panel? Okay, with that, I guess I'll say Andrew, Megan, Jessica, and Bethany, thank you so much for the hard work that you do on behalf of keeping Rhode Islanders healthy and fed. Your work is immeasurably important to all of our work and to our quality of life here in the state. So thank you for all your work and support. And we hope that you'll continue joining these conversations into 2024. Thanks very much. All right. The next item on our agenda is going to be Randy Belhumer is going to give us, if you give me 1 second, and I'm going to share my screen again. A summary of accomplishments of this group over the past year in 2023. Randy, are you ready to go?
Ready. Thank you, Rachel.
Okay. Yeah, and just let me know when you want me to click forward to the next slide.
Appreciate that. Thank you. So in the fourth quarter, we wanted to update you all on what we've accomplished together during the year, and recall that our goal is to reduce hunger and increase access to healthy, affordable, culturally appropriate food for all Rhode Island residents. And you can move on to the next slide. And so the objectives that are tied to this goal are noted on these next 2 slides. And so I'm going to read the first objective, which is to leverage and communicate the position of the task force as a key piece of the IFN PAC and the state's food strategy. And the HEF membership voiced that you wanted to engage more closely with state agencies involved in administering the nutrition programs. So we saw this as an opportunity to align the HEFT communities of practice with the state agencies. And you might recall that those 2 COPs in the past were serving older Rhode Islanders and SNAP WIC utilization. But right now we're in the process of, I guess you could say, reorganizing these 2 COPs that have been on hiatus for the past few months. And we're looking at ways that any COPs or working groups that we reform in 2024 will be action oriented and responding to some of the issues that everyone wants to address. And then the second objective is to improve nutrition security by identifying and educating network members and decision makers about policy, investment, and regulatory solutions to improve food security supply chain logistics. So in Q2 of 23, we heard about food recovery efforts happening in Rhode Island. And another success was the Food Policy Council leading the development of the Rhody Feeding Rhody Alliance with funding from the USDA. And I'll put the link in the chat for those of you who aren't yet connected to the Alliance, so that you can become connected to that body of work as well. And the next slide. And so the third objective is to reduce food insecurity by developing a centralized source for nutrition security resources for Rhode Island residents in partnership with on-the-ground HEFT members and state agencies. And I think most of you are familiar with the Food Access Bulletin, or the FAB, which stems from these quarterly meetings. And so in newsletter format, we update the membership on updates from key state agencies, from the health equity zones, and from other community organizations doing work in this space. And you can see the success that we've seen with the FAB over the past year if you look at that second bullet on the left on subscribership and open rate as well. And then the fourth and final objective for 23 is noted on the screen, with support from a consultant creating a food security plan for Rhode Island by engaging the HEFT network in resources. And I think everyone knows Rachel in her new role and over the years in previous roles. And Rachel has begun the process of creating this plan, which will serve as an accompaniment to the state's food strategy 2.0. And I'll pass it back to Rachel if you wanted to talk, Rachel, anything about that process right now before we move into your 2024 updates. Thanks.
Rachel, I think you might be on mute, possibly.
Thank you so much, Caitlin. So yeah, I'm happy to talk just a little bit about that process and where we are in the creation of the emergency food plan, which now, after much thought and work between Randy and Allison Macbeth and our staff here, and a number of other folks giving input, we have decided that we'll be the food systems preparedness and recovery plan, because we felt like those were really the concepts that encapsulated what we are trying to do with this plan. As of Friday, we released an RFP and are now taking proposals for the creation of that plan. I believe that it also went out via all of the Food Policy Council's social media and other communications chains, but please do reach out to me. I realize I don't have the link at my fingertips to share the RFP in this meeting, but we'll be happy to send it out to everyone afterwards. So we're expecting to get proposals in by December 1st, and we'll dive into the work as quickly as we're able to. That work is really going to emphasize the most vulnerable communities, families, and businesses throughout the state. And so really looking really deeply at the needs of those communities, where the gaps are in meeting the needs of those communities in times of emergency, and how we can build up our resources to do that. So it's very exciting. And I'm sure that many, if not all of you in this meeting right now, will be contacted at some point to give your input into that process. I'm going to stop sharing the screen now. Oh, I'll leave it on here. So my next step is looking forward into 2024. So we have been drafting the plan for the healthy, for an HETF plan for the coming year. We have 4 quarterly meetings, and the topics of those meetings that we've proposed are for Q1 to focus on the topic of food delivery. Q2 would be an opportunity for both reporting out and getting input from this group on the emergency food plan, or the preparedness and recovery plan. Q3, we're proposing having that as an opportunity to release and discuss the 2023 food strategy that Allison Macbeth on this meeting is representing here. And then we propose that Q4 be another meeting much like this one, talking about the state of food security in Rhode Island. The objectives in the coming year will be similar to in past years, to support cross-sector efforts to end hunger by lifting up effective community-based solutions and connecting smaller programs with information to overcome barriers to scale and remain sustainable. The second objective for next year of this group will be to create opportunities for members to learn and connect with other community-based organizations, nonprofits, state agency staff, and government officials regarding hunger relief efforts throughout the state. And the third objective will be to broaden membership in this group through targeted outreach to build a strong network of actively engaged stakeholders and actors, including engaging more representatives from community-based organizations such as the HESs and other community members. Excuse me. As Randy mentioned, in the past, there have been communities of practice, and in an effort to make those groups more action-oriented and make sure that they are helping to move forward everyone's goals for eliminating hunger in the state. We're reconfiguring that. Community of practice are not going to be any longer. Now they are going to be action groups. The structure of these action groups will be basically at every quarter, folks will opt to join an action group that will meet 2 to 3 times over the next 2 months to develop a series of recommendations about a specific issue to be delivered to state agencies. So, excuse me for 1 second. What we're really seeing coming out of this is that folks that are inspired and really feel that a specific issue is really important will then be able to develop solutions to that issue, and those will be able to be delivered to state agencies that will be able to enact those solutions. So the quarter one topic is something that has come up repeatedly, and then we know that people feel is an ongoing need. And so we are going to request that people choose to join an action group around food delivery specifically. If people have specific input on that issue, when we get to quarter one meeting, we will ask people at the quarter one meeting who wants to join the group and have that conversation over the next 2 months, specifically on food delivery solutions. And then in quarters 2, 3, and 4, we are going to leave it up to this group to decide what are the most important topics that we need to take on. So on the right hand side of the slide here, you see 6 topics that over the past year have risen to the top again as things people want to discuss and work on, things that people feel like need solutions. And I will read down them. And what we're going to do is allow everybody to choose the 3 most important, or if not the most important, I'll say the 3 topics that folks want to work on and able to work on the most in the coming year. Those topics are increasing access to subsidized summer meals outside urban centers. That's come up again and again, that summer meals are really difficult for children to access when they aren't in a tightly developed area, when they aren't nearby walkable to a park that has summer meals being offered, that sort of thing. There's also been a lot of conversation, not just in the past year, but over the years, about the challenge of having multiple on-ramps for state benefits, and the possibility of developing a single universal application to help people get into SNAP, WIC, and any other food assistance programs all at the same time. The third issue that folks have brought up again and again is alternatives to large food service management companies in procurement. So if folks are really interested in working together on figuring out how smaller, more local, or just other alternatives can be engaged for school, summer, and other nutrition program food service, that would be a great group to join if there's that. A related but different subject is, in general, when working with large food service management companies, what can we do to help increase local and culturally appropriate food served in through those companies? And if folks are interested in joining that, please do. There is the fifth one down the list here goes in two directions. One, increasing food donation by reducing food waste. So enabling organizations, or rather than throwing out food, to donate it to organizations that can get it to people in need. And then of course the flip side of that is reducing food waste by increasing food donation. There's increasing food donation and reducing food waste as the two sides of the same coin. And then the last one is on emergency food distribution. If folks are, and I see there's a typo, interested in working on solutions that have better coordination between the state, municipalities, and local nonprofits on emergency food distribution. So those are the topics that we're going to put out there for folks to choose the three most telling of those six choices. I'm going to stop sharing my screen for a moment. As I said at the beginning of the meeting, I am running tech and everything all at once. And one of the things that I'm running for the very first time is a poll for you all. So let's see how this goes. So I'm going to launch a poll for the 2024 action groups. And in this poll, what I will ask you to do is to check the three that you feel you are most likely to join another group of peers working on. And as I mentioned, the action groups will have will meet 3 to 4 times over the course of 2 months. So this is not an endless commitment, and it will have a real outcome of recommendations. I'm gonna launch the poll. Let's see how this goes. Do you all see those before you? All right, great. So I'll give folks a couple of minutes to please hang in there of the ones you see before you, what you think are the ones that you're most likely to join in with your peers on working on. And since we also have a smaller group than normal today, I think I will also send this out to the larger HETF mailing list and see what else we get. So far I have 4 folks who participated. That's great. If folks can keep putting in your thoughts, that'd be great. I'll give it 2 more minutes. So it looks like we have at least a plurality of people that have replied. Yes, Randy, I will send this out to everyone after this. All right, do folks need another minute to reply, or you feel like everyone who's gotten their thoughts in have them in? Okay. Okay. So I'm not sure if y'all are going to be able to see this, but I will tell you from what I can see, the Universal State Benefit Program applications seem to be the most popular, followed by developing school, summer, and CACFP procurement alternatives, and increasing local and culturally appropriate food and food service management. I'm going to end poll. Let's see. Oh, there we go. Can you see that? It's all working. Great. So I will send this out, and our update to the whole group will be what the results of all of them are, but that's great to hear that there are a couple that rose to the top already. And please let me know also, email or, in any other way, if you have some topic that you think is vitally important that didn't make it to this list. Great, okay. All right. so that's bringing us close to the end of our meeting. We have a final poll. Since that one seemed to go very well, I'm very happy. Give me 1 second. Oh, yes. Okay. Nessa, did you want to say anything to introduce the next poll, or do you want me to take that away? Is Nessa still with us? Jeez. Okay, I can introduce it. So the next poll, is very simple, couple of questions. We want to make sure that we are getting a good sense of how useful these meetings themselves are to those of you who join it. So I am going to share this poll, and also I will share it out to the larger group. There are two pretty simple questions here, which are, 1 second. How often do you attend these HETF meetings, and then how useful you find them to your work? Give me a moment. All right. So the first one, how often you attend them? Do you attend them every single quarter? Do you make it just once or twice a year? Or is this the first time that you made it to one of these in 2023? And then the second one is a scale of 1 to 5, how useful you find these meetings to your work. Okay. We have 9 responses so far. We got 9 to the last one, so I have a feeling this is the number of folks who are able to, or not in on their phone or whatever. So, and there we see. So it's great to see that 6 of the 9 of you come every quarter. That's fantastic. And it's great to see that we also have one person who this is the very first time you've joined. So we hope that you'll come back in 2024. And then it's also really encouraging to see that a lot of folks voted 4 out of 5 on how useful these are to your work. And 2 people said 5. So that's terrific. And we will be working in the coming year for the 2s and 3s to make sure that the work that these meetings are relevant and informative, and definitely appreciate any feedback that can help make them more so. With that, I will see you next year in 2024. 1 moment, please. I want to thank you for joining us for this meeting. We're looking forward to having you at our first meeting that will take place in the first quarter of 2024. And we will soon be sending out agendas and plans and dates for those coming meetings. So please keep your eyes and ears peeled. Thank you. See you soon.